Okay, hello guys. So this is the continuation of our discussion for DNA viruses. So this is part 2 of DNA viruses. So learning objectives or learning outcomes. At the end of the session, you are expected to be able to discuss the characteristics of adenoviruses and herpes viruses, to discuss the different diseases caused by adenovirus and herpes virus, and their clinical signs and symptoms, and to discuss laboratory diagnostics for the diseases caused by adenoviruses and herpes viruses. So to begin, let's start with adenoviruses. So these are naked double-stranded DNA viruses. They have icosahedral capsids, and of course, fibers would project, okay, from the capsid. Ayan, so mukha sila may mga antenna. These are really very important. They function for attachment. Okay, so our adenoviruses have a trapezium for mucosal epithelial cells that are found in the respiratory tract, your gastrointestinal tract, your urinary bladder, and the conjunctiva. Yeah, no. So this is the actual electron microscope image of the adenovirus, and very prominent ang kanilang fibers. Okay. So there are actually 6 groups of adenoviruses that may affect humans, and there are several serotypes. Okay, so they have been tested in rats and hamsters. Okay, so group B and group D are able to completely, okay, uh, agglutinate with red blood cells, while the rest are partially able to do that. In case of cancer formation, group A has a high risk of causing, or a high, uh, they are able to highly cause cancer formation in hamsters. No? So they were able to test this in hamsters. Good thing other groups are either weak or are not able to cause cancer. But of course, all groups are able to cause transformation of cells. So that's the beginning. Okay. So if they are able to cause transformation of cells, dili layo, no, na they are able to cause cancers in the long run. But for now, only group A has been tested to be highly positive for cancer formation. Okay. So adenoviruses are able to cause a variety of infections. And so most common is pharyngoconjunctival fever. So there's pharyngitis, and then associated with conjunctivitis plus fever. Okay. Uh, it's also known as swimming pool conjunctivitis. So when you swim in pools that have not been really um, decontaminated properly. Okay. So you'll be swimming with saliva, within pools that are contaminated by urine, saliva, respiratory secretions. Usually serotypes 3 and 7 are involved in this type of infection. Yan, no? So, klaro kaayo ang swelling, and of course, yung purulent na tonsils. Ito naman really inflamed, really red. And then conjunctivitis. Okay, so the type that's commonly caused by adenoviruses is epidemic keratoconjunctivitis. So there's acute conjunctivitis followed by keratitis. Okay, so na-inflame ang conjunctiva. Tapos na-inflame din naman ang cornea. No, so yun yung keratitis. So this type of infection involves serotypes 8, 19, and 37. Okay. So mainly this involves adults. Okay? So highly contagious din ang infection na to. Okay. Adenoviruses are also associated with gastrointestinal infection, specifically infantile gastroenteritis. No? So adenoviruses are known to cause gastroenteritis in children, with gastroenteritis. About 5 to 15% of them are surely adenoviruses. Pero hindi naman si adenovirus ang number one cause, no? It's rotavirus, but adenoviruses can still cause these types of infections, specifically serotypes 40 and 41. And then our adenovirus is also known to cause hemorrhagic cystitis, no, or bleeding in the urinary bladder, okay? Because nga it has an affinity for the mucosal cells of this particular tissue or organ, okay? Now, adenoviruses are also known as agents of respiratory infections, okay? So, common colds, and no, there's coughing, nasal congestion, sore throat, fever. In children, the usual serotypes involved in this type of infection is serotypes 1, 2, and 5. And for adults, we have serotypes 3, 4, and 7. Okay. It can also involve the lower respiratory tract, no, causing pneumonia. So that would involve serotypes 3, 7, and 21, still in children. Adenoviruses has also been known as agents of respiratory infections in military camps, no, in U.S. military camps. However, they were able to successfully reduce infections in those areas because of the adenovirus vaccine that was developed. It's an orally administered vaccine. These are coated tablets that would contain live adenovirus, specifically types 4 and 7. Okay. So laboratory diagnosis, PCR, of course, no? So you can do PCR, you can do cell cultures, no? For cell cultures, you can use low passage cell cultures using primary human embryonic kidney cells, or you can use continuous cell lines, no? Like the HeLa cell, and then you can do immunofluorescence. For laboratories that cannot do, no, or is not equipped to perform cell culture and immunofluorescence, you can do serological testing, you can do complement fixation, neutralization, and hemagglutination inhibition tests. No? Ayan, di ba? So to review, we were already able to discuss this, yung complement fixation test, right? So if the patient's serum is positive for the antibodies, okay? Therefore, it would react with the antigen reagent, no? Triggering the complement. Okay? So it would not react anymore with the sensitized RBCs. So if the serum is positive for antibodies against adenoviruses, there will be no hemolysis. However, if the serum does not have antibodies against adenoviruses, there will be hemolysis. And then, of course, neutralization, right? So if toxins come into contact with cells of an uninfected individual, so that would cause cell damage. However, if the patient is already positive for the infection and has developed antibodies or antitoxins, no? So when the toxin is introduced, it would just be neutralized by the antitoxin present in the patient sample. So, maneutralize ang toxin. Therefore, dili madaot ang cells. Okay? And then, of course, hemagglutination, no? So, if the patient sample is positive for antibodies, okay, the antibodies would attach to the antigenic reagent. So, therefore, maneutralize, no? Walang agglutination with the RBCs na mahitabo. Okay? However, kung wala siya, no, negative for antiviral or antibodies rather, so there will be nothing to attach to the antigenic reagent used in the test. So mag-agglutinate siya with our RBCs. Okay? So this is HAI or hemagglutination inhibition tests. So ma-inhibit ang hemagglutination kung positive sa antibodies ang sample sa pasyente. Okay? Pero kung wala gani antibodies, dili ma-inhibit. So naay hemagglutination. Okay, so pag may hemagglutination, negative. Gaya lang din ng complement, pag negative ang serum, nagkakaroon ng hemolysis. Ito dahil negative din ang serum for antibodies, nag-positive for hemagglutination. So pag negative yan for hemagglutination, na-inhibit ang hemagglutination, positive ang sample ng patient natin. Okay? So moving on to herpes viruses. So note that there are 8 groups, no, for herpes viruses. We have HHV1 until HHV8. Okay, so your HHV1 is herpes simplex 1, HHV2 is herpes simplex 2, HHV3 is your chickenpox virus or the varicella zoster virus. All three of them, 1, 2, and 3, are alpha herpes viruses, okay, or members of the alpha herpes virinae family. Your HHV4 is the Epstein-Barr virus, which is a gamma herpes virinae, similar with HHV8 or the Kaposi sarcoma associated herpes virus. It's also a gamma herpes virinae. HHV5 is the cytomegalovirus. HHV6 and 7, they're all beta herpes virinae. So 1, 2, 3 are alpha. 4, 5, 6, 5, 6, and 7 are beta herpes viruses. And then 4 and 8 are gamma herpes viruses. Okay, so for this discussion, we will cover alpha and beta, and we will reserve gamma herpes viruses in the next part of this discussion. Okay, so let's start with alpha herpes viruses. So these are enveloped double-stranded viruses, no? And they do have DNA. So DNA viruses man po na nga tong topic. So no, these are enveloped double-stranded viruses containing DNA. They have icosahedral capsids. Again, most DNA viruses have icosahedral shapes, with the exception of pox viruses kasi complex, no? Parang brick ang shape nun. Okay, and then alpha herpes viruses would include your HHV1, 2, and 3. No, so your herpes simplex virus 1 and 2, and then your HHV3 or the varicella zoster virus. Okay, so general characteristics natin, they are rapidly growing cytolytic viruses, or they are able to destroy their host cells. They are all positive for vesicles. Okay, so part of the infections that they cause, the most common sign would be the presence of blisters or lesions or rashes, that would become vesicles later on. Okay, and these are also the group of herpes viruses that are known to be able to establish latent infections in the neurons. Okay, so let's start with our herpes simplex virus. Okay, so we have 2 types. Okay, so herpes simplex virus 1 usually affects the mucous membrane in the upper part of the body, and that would be our mouth, our nose, and our eyes, right? So they would easily be spread from secretions coming from those mucous membranes. They would produce, vesicles like this. Okay? These are really painful vesicles, usually around the rim of the lips, sometimes near the nose. Okay? Or they could also be found in the eyes. Okay? These are able to stay dormant in the trigeminal ganglia. Okay, so dito pag magtago sa trigeminal ganglia ang HSV1. Now, HSV2 is acquired through sexual contact, no? So you have come in contact with secretions from mucous membranes in the lower part of the body, and that of course would be from your genitals or sa anus, pwede rin, pero very common sa genitalia talaga. Okay? And this could also be acquired by newborn infants when they come into contact with the contaminated birth canal. Okay? Again, very prominent ang painful lesions, vesicular lesions. And these types of viruses are able to stay dormant in the sacral ganglia. Okay, so see HSV1 sa trigeminal ganglia, HSV2 can hide and stay dormant in the sacral ganglia. Okay, so yung malapit sa likod natin. Okay, yung trigeminal yung dun sa may ulo, banda. Okay? Now, of course, again, no, as mentioned previously, nakakapag-cause talaga na uh, dormancy, no, itong ating alpha viruses. Okay, so the virus would enter through mucosal surface, or it could also enter the body through broken skin. Okay, and then it would replicate on the site of infection. Okay, once it has replicated, it could invade local nerve endings and is then transported to the ganglion, where it would further replicate, and then it would proceed to latency or dormant state. Okay, now once there's stimuli like physical stress or emotional stress or high fever or exposure to uh, ultraviolet light, for example, that would cause reactivation of the virus. Okay, so the virus follows back to the peripheral site, and then it could replicate in the skin. Okay, so most are actually asymptomatic or may present milder types of infections, okay, especially in immune competent individual. Magkakaproblema nga lang talaga pag immune compromised ang pasyente natin. Okay? Yan. So our viruses, now your herpes simplex viruses are also known to cause meningitis or encephalitis, specifically your HSV1. However, okay, pwedeng mag-interchange yun, no? If, for example, like may sexual contact, merong nag-oral sex, for example, tapos yung sa isang partner, meron siyang lesion sa mouth, okay? And then nag-oral sex sila, pwedeng ma-transfer yun, no? Yung virus dun sa lesion sa mouth into the genitals and vice versa. Okay? Yan. And then, again, no, your HSV1 specifically is also known to be able to cause oropharyngeal diseases, no? It could also involve the pharynx, like that, no? Nagkakaroon din ng blisters sa loob ng bunganga. Okay, so may herpetic pharyngitis, there's herpetic laryngitis. In children, children could suffer from herpetic gingivitis, no? So may mga blisters din sa may gums. And in some cases, there could be gingivostomatitis, yung parang may cold sores, no? Murag ka ng daing mga luas sa sulod sa baba, sa may gums specifically. Okay? Yan. Ayun, di ba? Mga gingivostomatitis. Ayan. Hmm. Mm. And then they're also associated with keratoconjunctivitis. So, inflammation of the eyes nga, no, ng conjunctiva and the uh, cornea. Okay? So, pwedeng may, this could be due to direct inoculation, okay? Or sometimes droplet transmission. So, there's keratitis or corneal ulcerations. No? People with this type of infection can go blind, especially if recurrent ang infection. And then meron din namang vesicular lesions on the eyelids like this. This one is herpetic whitlow. Ayan, no? So, ewan ko anong ginawa. Bakit may ganyan? Okay? So, may mga blisters din yan. Masakit yan. Hindi yan makati. Okay? And then, of course, herpes gladiatorum, which is caused by contact sports like this. Ayan. So, nagigit-gita kayo, yakapan kayo na yung kalaban. So, pagkatapos nun, ayan na ang kapalit. Ayan, no? So, may mga lesions, may mga blisters. These are really painful. And this one most especially. Okay? So, dahil sa ano yan, sa wrestling or contact sports. And then, syempre, we have genital herpes. Ayan, no? So, may mga blisters din naman sa mga genitals. So, this is care of your HSV2 most commonly. Ayan. Diba? Ito naman. So, una, magbe-blister yan. And then, pumuputok yan, nagiging ulcerated. Okay? And syempre, pag ganito naman ang lalabasan ng baby, o di natural, pwedeng magkaganyan. No? So may neonatal herpes. So this is most commonly caused by passage of the neonate through an infected birth canal. Okay? Or sometimes infants could acquire this from family or healthcare worker. Okay? So 2 or 3 years ago nga, no, merong 2-day-old na infant namatay sa US yun dahil nahalikan ng nanay na merong herpes sa bunganga. Sayang, di ba? 9 months mong dinala, pagkatapos hinalikan mo lang namatay, sayang. Okay? So, ano talaga siya, no? Importanteng maingat especially for neonates like that. Because the mortality rate is 50%. That's really high. So there are 3 categories to neonatal herpes. The presentation could be similar to this. No, there are localized lesions sa skin, sa eyes, sa mouth, okay? Or it could be in the form of encephalitis. Okay? Ito mas nakakatakot. Pwedeng with or without localized lesion, pero nasa utak na pala. No? Or worse, if it has disseminated in uh, multiple organs. Okay? So anong gawin? So what do we do in the laboratory? You can, of course, perform PCR, or you can do cytology, histology, perform your chunk smear like this. Oh, yan, no? Gamit niyo yung scalpel. So if you flip mo yung top ng blister, so you could collect no yung fluid galing dun sa loob. Okay? And make a smear out of that. And then stain it with your histologic stain. It could be H&E or whatever the protocol is in your laboratory. Okay? And then try to find this inclusion. So these are Cowdery type A, so very visible in tissue biopsies. Okay, so these are intranuclear acidophilic inclusion bodies. Yan. And then what else? You can do tissue cultures like this, no? So trypan blue is quite common, no? To show confluency. Okay? So in preparation, dapat ganito, no? Confluent yung ating cells, marami. And then check it a few days after infection, no? After infecting the cells, ayan, nakikita mo parang nakakalbo na yung ating cells. And then 3 days after, ayan, yung mga malalaking area na nawala ng cells, no? So indicating cell lysis or cell death. Now again, if your lab can't perform tissue cultures, no worries, because you can do serological testing, which are much more cheaper. You can do neutralization assays or ELISA, no, specifically the sandwich type of ELISA. I believe this has been discussed in your serology, no, immunology and serology subject. So we'll go ahead and discuss the treatment. So treatment for this one is acyclovir. And then syempre for prevention, avoid contact, no? So kung nakita ng merong herpes ang kasama or yung kalaro mo, avoid that. Syempre kung ikaw naman merong herpes, huwag ka namang lumapit dun sa walang herpes, di ba? Okay. I think in the US they're trying to do away with herpes gladiatorum for players. So pinupush nila nakasama yun sa pag-test bago palaruin yung mga players, lalo na pag contact sports. Okay. Then next we have the varicella zoster virus. So this is the third member ng alpha herpes virus. So this is our causative agent for chickenpox. Okay, so like herpes simplex, these are also known to produce herpetic lesions like this, no? Mga vesicular lesions rather. Ayan, klaro kaya ang pagka-vesicle. Okay, so alam na alam natin fluid filled pag ito ang itsura. And then eventually this could become pus-filled din, no? So magiging pustules. So like the herpes viruses, our VZV is also known to be dormant and stay in the dorsal root ganglia. So if it's reactivated, the infection is now called shingles. Okay. And so, chickenpox is also known as varicella. There is about 10 to 21 days of incubation period. The infection may be acquired through inhalation of respiratory droplets or contact with the infected secretion to the conjunctiva of a susceptible individual. The not organism, the infective agent may replicate in the regional lymph node, and that would be followed by primary viremia. No? So once there's viremia or an increase in the number of virus load or viral load, that would lead to replication in other organs as well, no? Like the liver or the spleen. Okay? And then that would signify secondary viremia, no? I-increase na naman yung load na virus. That would lead to uh, the lesions on the skin. Okay. So these are the three phases of the chickenpox rash. So we have discussed this previously in part 1. Okay. So di ba meron nung macula, okay, or red rashes. Now, sa chickenpox, parang nag-combine na yon, macular papular rashes or maculopapular rashes. So red, slightly raised bumps. Eventually, that would develop into blisters or vesicles, no, na fluid filled. And then that fluid will later on become pus, so magiging pustule. It would dry up eventually and create crusts, no? And scabs, yung brown-brown na nakikita natin. Okay? Yun, pag na-develop na yung scabs, yun yung time na medyo makate, gustong-gusto mong kamutin yun. Okay? So, dapat hindi. No? So, let the scabs fall off on their own. Otherwise, pag kinalot mo yun, kinamot mo yun, baka may fluid pa sa loob, 'di ba? So pag kinamot mo 'yun, pupunta sa kuko mo yung fluid, tapos kung saan-saan ka hahawak, oh, 'di ba? So dapat iwasan. Okay? So these are the lesions for shingles. Again, this is the reactivation of the chickenpox virus. So most commonly, the lesions of the vesicular lesions are grouped together rather than dispersed gaya ng sa chickenpox. No? Sa chickenpox, ang lesions can be seen from the top of your head up to the uh, soles of your feet, pwedeng dun, no? Palibot. Okay? However, for shingles, the lesions are packed in one area, like this. Okay? Or like this, which is very common. Yan. Sa may trunk area. Okay? So what do we do in the laboratory? Okay, so you can perform, of course, PCR, no? You can do chunk smear. Okay, so pwede ka mag cytohisto, so you can do chunk smear, okay, and find multinucleated cells, no? Hanap ka nung ano nung syncytia. Okay, or kung meron mang electron microscope, edi mag-electron microscope gaya niyan, no? Or you can do immunofluorescence. Okay? Siyempre, this is treatable, no? So, you can provide a cyclovir sa pasyenteng may chickenpox na para hindi masyado dumami yung kanyang vesicles, no? Or yung kanyang lesions. But of course, this is preventable. Pwedeng-pwedeng ma-prevent through vaccines. So, may vaccines tayo. 3 doses then, and then I believe there's a booster shot. Okay? Again, the site of latency for VZV is the dorsal root ganglia. Okay. Now, moving on to the beta herpes viruses. Now, that would include your HHV5, which is the cytomegalovirus, and the HHV6 and 7. Okay. So, infection with cytomegalovirus is actually very common. You know, about 60 to 90% of adults is believed to have been infected with the virus sometime in their lives. Okay. So, once infected, the body usually retains the virus for life. Okay. So, ganun talaga pag herpes. Okay? Once you have that, you may have it for life. Okay? However, it does not actually pose as a big problem for people that are immune compromised, immune competent. It's mostly a problem for immune compromised individuals. Okay, so transmission of CMV is usually through inhalation of respiratory droplets, like when you're talking to someone who's sneezing or coughing, or exchange of saliva when kissing. Pwede rin naman through sexual contact. Okay? And then commonly through blood transfusion or vertical transmission from yung transplacental, no? From mother to child. Or pwede rin namang from breastfeeding. So the infant can get infected through breast milk or through transplantation or contamination with urine and feces. Okay, so the site of latency for cytomegalovirus are WBCs and the endothelial cells of the uh, endothelium, no, ng mga blood vessels natin. Okay? So CMV is known to cause a variety of infections. However, again, for most individuals that are immune competent, they may be asymptomatic. Okay? Symptomatic lang talaga pag immune compromised ang host. No? So marami siyang signs and symptoms. And then CMV is also known to cause congenital diseases in the newborn kasi nga it can cross the placental barrier. No? So it's part of the group of organisms that are known to cross the placental barrier. Siya yung letter C dito sa torch. Okay? So torch, kasama dun si Toxoplasma, your Treponema, chickenpox, parvovirus, HIV, rubella, herpes simplex virus. Okay? So these are agents of congenital diseases of the newborn because they can enter the transplacental barrier. Okay, so it's transmitted again through to the fetus through the placenta or when passing through an infected birth canal or through breastfeeding. Okay, yeah. So these are some of the signs and symptoms, no? Or the syndrome of infants that may have congenital disease, no, caused by CMV. So there's impairments sa eye function, ear function. There may be brain abnormalities like this, no? Very common yung microcephaly. And of course, if there's microcephaly, kasama na dun yung mental retardation. Some infants may develop epilepsy, no? Some may have may be born prematurely, okay? Or some may be born with a low birth weight. Okay? There may be liver, lung, and spleen issues, especially pag premature ang baby. And some infants may suffer from coordination disorders, parang dyspraxia. Okay? Walang problema sa intellectual capacity, pero walang coordination, no, yung kanyang utak at saka yung mag-e-execute ng action. Minsan natutumba. Gusto niya maglakad pero dahil walang coordination, so matumba, madamag, ana, no? So again, for infants na affected by CMV. Okay? So what do we do in the lab? Syempre pa, PCR ulit, no? Or if you can perform immunofluorescence or syempre, pag wala tayong PCR, walang immunofluorescence, pwede namang mag-cytohisto. Madali lang yun, di ba? So pag nag-cytohisto tayo, sample lang, no? Usually blood sample, or it depends, syempre. No? Although blood is the specimen of choice, but of course, you can collect other samples depending on the presentation of the infection. So you can do cytohisto and check out for CPE. Okay? So pag nag-CPE, check the owl's eye inclusion bodies like that. Yan, ito na talaga yung mukhang owl's eye. Okay? Or you can do serological testing, detect IgM or IgG. Again, if blood is the sample that you have collected, think about polymorph prep, no? So, di ba nga, the site of latency for CMV is WBCs. Okay, so mas maganda if you can separate your WBCs from your RBCs para mas madaling mag-identify. No? So treatment is available. Usually it's ganciclovir. Okay. So, na-discuss na rin natin yung volume of blood previously. So, around 5 ml. No? Again, it would be best if you can collect it in anticoagulated tubes containing EDTA or citrate or heparin. But if you're going to perform PCR, it's best to stick with EDTA tubes. No? Again, it's good also to collect around 2 tubes, especially for leukopenic patients. Sorry po. And then last for today's discussion, no, for this parts discussion, we have the human herpes virus 6 and 7. These two have a 50% homology, which means around 50% of their characteristics are similar. Okay? And they're known to cause roseola infantum or exanthem subitum in young children. So usually before mag 2 years old, no, kadalasan yung mga infants nagkaganito na. Okay? Pero in fairness, sa tatlo kong anak, isa lang nagkaganito. Oo, yung eldest na child ko, nagkaganito talaga siya. And this is really mahapdi, no? Lalo na pag pinagpapawisan. Tapos meron dun sa singit ng leeg, sa kilikili, yan, nakati, na masakit. Okay? Pag nabasa. So it is also present in the saliva. First, nagfe-fever muna yan. That's common for viral infection. Mag-fever muna 3 to 4 days. And then pag subside ng fever, pag nag-normalize ng temperature, saka naman lumalabas yung mga rashes. Yan. So rashes would start here sa trunk, gaya nitong si baby. And then bababa yan sa may buttocks and then sa thighs. Okay? So sa singit-singit yan, lalo na pag sa may diaper banda, agoy, no? Hapdos kaayo na. So, maghilak-hilak jud ang baby. Okay? So, that ends our discussion on DNA viruses part 2. Study well. Again, thank you for listening.